sure that this is okay. So we should be good to go for recording. Alrighty. So welcome to our next presentation on behalf of our T-SOFI webinar series. Please remember to mute your lines. If you have a question, feel free to type it in the comment box and the presenters will go ahead and answer them at the end of their presentation. Please complete the post-webinar evaluation so that you can receive CHESS or you should be a featured presenter in our webinar series for the remainder of this year or even next year. Please email texassophie@gmail.com. So today's webinar is titled The Fourth Trimester Lessons from a Postpartum Navigation Program on Improving Patient Engagement and Maternal Health. And it'll be presented by Jennifer, Ashley, and Alejandra. So please welcome, or please help me in welcoming our presenters.
Haley, before we begin, can you give me rights to share screen?
Yeah, so I think I have to stop sharing. Okay.
Well, as we transition to the presentation, I want to thank Texas SOFI for this opportunity and thank all of you for joining us during your lunch hour. We are very excited to present this program. This program is very close to its 1-year anniversary, and we're excited for the opportunity to share what we've learned. Before we begin, I do want to say a thank you to all of you on the call today who are frontline healthcare workers. This has been a very trying time for us, and we consider all of you to be healthcare heroes. So thank you for your work on the front line during the coronavirus pandemic. One thing you will hear as we present this program are the changes we had to make in response to coronavirus. The program began about a year ago now, and about halfway through, we had to make some significant adjustments. And you'll hear from all of us about the changes we made in response to the coronavirus pandemic. My name is Jennifer Hedaya. I am the Senior Director of Public Health here at Legacy Community Health, and I'll tell you a little bit about who we are. I do have two co-presenters with me today, Ashley Minkyu, who is our Public Health Manager overseeing this program, and Alejandra Zuniga, who is our Postpartum Navigator. We will all three be steering this presentation today, and I will hand off to my co-presenters, and then eventually they'll hand back off to me. So let's get started. First, I want to share what our learning objectives are for today, and we have 3 of them. We want to, first of all, describe the rationale for why we designed a new initiative focused on high-risk maternity patients and newborns. What was the impetus for our postpartum and pediatric navigation program? We then want to outline the procedural steps, educational content screenings, and referrals involved in the program. Our intent here is to provide enough detail for those who may be interested in integrating similar concepts or launching a similar program in their own settings. And then last, we'll describe the challenges we encountered with this program and where we're going next. So let's begin with who we are. Legacy Community Health is the largest FQHC in the state of Texas. We were founded in 1978 as the Montrose Clinic, and our mission was to serve those who were living with HIV. We were originally located in one of Houston's historically queer neighborhoods to meet the need in that community. Fast forward to today, we are the largest federally qualified health center system in the state of Texas with 36 locations in Houston, Baytown, Deer Park, and Beaumont. Of those 36 locations, 15 are standalone primary care clinics, and the others are school-based health clinics in local charter schools. Legacy as an organization has multiple service lines. One of those service lines is the public health service line. So I want to say a comment about who we are, Alejandra, Ashley, and myself within Legacy as part of the public health team. That's the team you see there on the left. I do want to point out, as you'll notice in the text, this picture was taken in 2018. It was not taken in 2020. And you can tell that simply by looking at it. We are not physically distanced and we are not wearing masks. I do want to be clear, this was not taken this year. Legacy Public Health is a service line within our FQHC system. We apply public health principles and practices to the goal of keeping our patient populations and community members healthy. Most of our team in Legacy Public Health are health educators and apply the principles and practice of public health education similar to those that T. Sophie promotes. So by the numbers, Legacy served over 125,000 unique patients in 2019. We are still awaiting our 2020 data. About 87%, or the vast majority of those patients, are persons of color, and almost half are people who are best served for their healthcare in a language other than English. 35% are uninsured, over half are at or below 100% of federal poverty. Legacy's mission as an FQHC is to serve those who are uninsured or underinsured, but we will serve anyone in our community who needs access to high quality and affordable healthcare. In 2019, we saw almost 11,000 prenatal patients, unique patients throughout all of our standalone primary care centers. 77% of those patients completed a prenatal visit in their first trimester. This is significant because we know how important early and often prenatal care is, and compared to the rest of Harris County, our patients are doing much better. In Harris County, about 55% of pregnant people have a prenatal visit in the first trimester. At Legacy, that percent is 77%. I do want to make one more comment about our response to coronavirus and the photo you're looking at today. If this photo were to be taken today, you would see rigorous infection control standards put in place, which we also apply in our work in postpartum and pediatric navigation. We are screening, we are masking, we are distancing, and we are disinfecting. And I think it's important to note that this presentation won't focus on those things, but we have integrated those activities into our day-to-day work, including in our postpartum and pediatric navigation program. So with that introduction to Legacy, I'm going to give my first handoff to Ashley Minkyu, who is the public health manager who oversaw the creation of our pediatric and postpartum navigation program, to talk to you about what our system looked like at Legacy pre-PPN and post-PPN, to give you a sense of why we pursued this program in the first place. Take it away, Ashley.
Thank you, Jen. So again, thanks everyone for joining us this afternoon. With postpartum, before we had the postpartum navigation program at Legacy, a patient would have the ability to come in for a free walk-in pregnancy test. This is something that we still provide at our organization today. Once that patient was identified that they were pregnant, then they were linked to prenatal care and education. And then, of course, we worked with the patient and ensured that they continued with care throughout their pregnancy with Legacy. At the time, since Legacy is not a hospital system, the patient would then transition into hospital navigation, where one of our partnering hospitals would have a navigator that hopefully and ideally would transition that patient back to us. However, sometimes the Houdini effect occurred and we had patients who kind of disappeared. We would work with the patients again and we would have the information from the hospitals, but however, we were unable to recapture those patients into care for the postpartum period as well as for the pediatric period for this new baby that has been born. Next slide, please. So with the addition of our PPN program, we've added some additional steps. Advance, please. Perfect. Thank you. So we have included some additional touch points with prenatal care and in the prenatal care and education period where a patient enrolls at their 30-week visit. So we have the opportunity to reach out to the providers, have an opportunity to explain the program to the patient and work with these high-risk patients before they transition into the hospital navigation. So then a patient is able to, of course, go and deliver at their hospital of choice, and they are able to contact our navigator to engage with them with post-delivery engagement. At this time, they also share the parenting action plan and discuss what that is and if it is a good fit for the patient. Then we are able to transition into having postpartum visit engagement where previously, again, instead of having the Houdini effect, we had an opportunity now for the patients to have a warm touch with our navigator, of course, COVID friendly, to then transition and make sure that they are being engaged back into care at Legacy. Then beyond this point, we have the pediatric visit engagement, where our navigator, again, is having the opportunity to engage with the patient, make sure the baby has their newborn visit schedule, make sure all appointments are being kept, and then we can continue them into care within Legacy Community Health. Next, I'll transition to Alejandra Zuniga, who is our navigator focused on this program. Alejandra?
Thank you. So my name is Alejandra Zuniga. I'm the postpartum navigator. Just to share a little bit about myself, this is my daughter. Her name is Sophia. And one of the main reasons why I am passionate of the work that I do, I had Sophia when I was a college student. And one of the things that I won't ever forget whenever I was being interviewed by Jen and Ashley and the rest of the public team was, one of the questions was why or how do you feel that you will make an impact on these postpartum women and their families? And I said, I know that I will make an impact because I was that person at one point. So I was a young mom, and I needed a lot of advice, and I needed someone there to have my back. And I used some of the resources that now I give to my patients, because I know how it is to be a young mom and to need all the help that we can get. So this is Sophia as a baby. Now she just turned 7 years old, and is full of life and adventure and questions. And so I just wanted to share a little bit about myself and why, how I started this, and why it's very important to me, because anytime that I see any of these newborns, which is the most favorite part of my job, by the way, seeing the babies. I always think, what can I do to make, this baby's life better? What can I do to make this mom's life easier? And I'll start by explaining a little bit about how the program works. So as Ashley mentioned, we do meet these moms at their 30-week appointment. And so I meet the high-risk OB patient at their 30-week OB appointment, and I introduce the program to them. I do want to mention what high-risk OB patients are, and that is a patient that has experienced any of the following: history of preterm labor, patient at risk for preterm labor, patient has an existing obesity diagnosis, or patient has gestational diabetes. And so I meet the patient at their 30-week appointment, and I introduce the program to them. And I also tell them about all of our public health prenatal education classes that are offered. And just kind of a side pointer, you don't have to be a legacy patient to take these classes, but I do introduce them. And if they are interested, I go ahead and I sign them and I enroll them into the class. Some examples of the classes that we offer are the Becoming a Mom class, car seat safety class, breastfeeding class. All of these classes are great, and most of the patients that take them, they're all, very, very satisfied with the class, and they say that they know so many things that they didn't know before. And again, I also think back to myself, and when I was training and I was in these classes, I thought to myself, where were these like 7 years ago when I had Sophia? Because they are very, very useful information, and they help our patients a lot. Something else that I also do is I also assist in referrals to internal or external departments. Some examples are if they need help enrolling into WIC, I'm able to, I actually worked for WIC for 3 years. And so I'm able to kind of give them like, the tips and like oh, you should buy this with your card, or let me send you to the closest WIC, let me find that for you. So again, just being a resource available to assist in any questions or concerns that they have. And if they also need anything else, such as social services and behavioral health, those are departments within Legacy that I'm also able to put in an order and get them the help that they need, so that they are able to get in touch with those departments. Next slide, please. And so after I meet the patient at their 30-week appointment, and if they agree to enroll in the program, which let me point out that also, whenever I do introduce the program to these patients, they're really excited about having someone who is a direct point of contact, especially now more than ever after COVID. Legacy was one of the first ones that started with like the COVID testing, and we have a lot of information. We already have so many service lines and patients, and so it's normal that like our sometimes our contact center takes a little bit longer than usual, or sometimes our caseload has grown exponentially so much that sometimes like it'll take a little bit longer for one of our clinic staff to respond to these OB patients when they have questions or concerns. And so they're really excited about just having someone that they can just call and be just, we don't have to wait so much longer to get a response, because they can just let me know, and I can either instant message our provider or just get them help a little bit faster than they would as if they were to call our contact center. And so I follow the patient for the remainder of the pregnancy, and like I said, just be a direct point of contact so that they if they have any questions or concerns, I'm able to assist them with that. I am also able to reschedule missed OB return appointments to ensure prenatal care is completed. That is extremely important, especially now. Like we mentioned, COVID, a lot of these patients were concerned about coming into the clinic. There was a lot of information about pregnant women are considered high risk. Whenever all of the new information about coronavirus was coming out, and so we did have a lot of missed appointments. And so again, it's a little bit easier for them to contact me and say, hey, I missed my appointment, I need to be seen every 2 weeks, can you help me reschedule that? So I do assist them with that, and I also do follow up with the patient by a phone call at 36 weeks to kind of check in, see how the patient is doing, and then just kind of remind them of importance of following provider recommendations until delivery. I also kind of just remind them to let me know once they have delivered to schedule a hospital visit. And it was actually really cute too. And I actually shared some of these pictures with Jennifer and Ashley. Some of my patients will send me pictures of like their babies, like when they're like just born, they're like weigh them and like they're like on the scale. And I've received a couple of pictures. So it's really nice and warm to think that, they would think about me to send these pictures to, because I feel really special, that I have received some of these pictures and that they feel that close connection enough to like, hey, by the way, my baby's born. Oh, here's a picture. So it's really neat thing. So then the step 2 is hospital navigation. So I meet them at their delivery hospital during their postpartum period. And I re-educate again on the importance of postpartum pediatric care for the patient and the newborn. And I assist them in scheduling postpartum appointments and the initial newborn appointment after hospital discharge. Sometimes the postpartum appointment can already be scheduled by the clinic before they even deliver, but it kind of comes in handy whenever, for example, a C-section. Some women don't know they're gonna end up having a C-section, so then you do have to have a 2-week follow-up after a C-section. So again, it is very easy for me to assist them, and then just scheduling that, that follow-up, even if they already have like a 6-week postpartum appointment. And then step 3 is the pediatric navigation. And I ensure that after hospital discharge, the newborn continues to receive pediatric care. And it's been interesting to see, like Jen mentioned, we've almost been doing this for a year. And it, when a woman delivers and they're in the hospital, they're thinking about a million things, and you're already tired, and you just had a baby, and your hormones are all shifting. And so, even if I have, completed my education component of how important this initial newborn pediatric visit is, sometimes, it's easy for, mom to be too tired, or to simply, sometimes whenever you're during your postpartum period in the hospital, like it's like you forget what even, some of the things that they told you, or like what you're supposed to do. And so I think that the pediatric navigation is extremely important, because it ensures that the newborn did make it to their first appointments. And like I said, even now more than ever with COVID, these moms are scared, and it's important to just reemphasize and let them know, it's okay. I know Jennifer mentioned some of all of our clinics are taking extra steps, extra precautions, to ensure that, you're going to be safe, your baby's going to be safe. And even whenever we started telehealth, right? It's all everything's virtual now. But with OB and pediatric, especially the newborns, it's kind of hard to do telehealth, right? So I made a joke with one of our providers. How funny would it be to be like, can you put your baby on the scale, like over webcam? Like, let me see that weight. Like, is that 0.2 ounces, And so it's really important to just, again, reemphasize that even though telehealth is new, and it's something that Legacy was one of the first ones to just, get on that bandwagon, because it's easy and convenient with these initial newborn appointments. It's hard to do, just because, they do need to get newborn screening sometimes, the weight. And so I assist them. And again, any questions, concerns regarding the initial newborn appointment. And then I meet the patient at the initial newborn appointment for a co-visit. And at that appointment, I do provide education on parenting action plan. And that is through Safe Babies. And what I do is, if they're interested in the information, which is a booklet that we provide to them, and I haven't had anyone yet tell me that they're not interested in information, but the information is very useful, and it talks about how to develop positive coping skills, how to increase parenting self-efficacy, and helping them, it helps the parent have realistic expectations about parenting a newborn. And so, like I said, I always say, like, whenever you have a baby, there's no manual, right? Like, there's no, you can read all the books that you can read, that you should read, and take all the classes and educate yourself. But I think that the more information that these parents have, you feel a little bit, safer, and you feel, more confident. And so I think the parenting action plan is a great way to, kind of just re-emphasize some of these, positive coping skills, and how, interacting with your baby, and how that can have a positive impact on their future. So I think that the parenting action plan is a great component. And we, like I said, when we started doing that, I was really excited, because it also gives them something for them to take home. And another thing that it also comes with the booklet is that you can it comes with a clip that you can hang it on your diaper bag. And so it's good to just have something to look at, and then again, just not only re-emphasize the education, but for them to actually have something on hand, to read after, because again, it might be information overload also at the initial pediatric visit. And so it's nice for them to have something to just take home and kind of go back and read. And so I pretty much follow the patient until their postpartum appointment is completed. And that is something that is extremely vital and important in our program, because again, it is very easy for mom to take care of, this newborn baby, and the rest of the family, if they have more family. Some of these moms, by their 6-week postpartum, they're already working. And so it's easy to miss these appointments, and it's easy to just think, if baby's taken care of, then that's all that matters. And so that is a huge component of this program, to ensure that they have health coverage after the postpartum period, and then also to make sure that they complete their postpartum period. And if they're going to lose coverage after their 6-week postpartum period, I am able to assist them in getting them through our eligibility process. And that allows them to have a sliding scale if it hadn't been previously completed. And so I cannot emphasize enough how many of the patients that are in my program benefit from this, because a lot of them do lose coverage after their 6-week. And like I said, it's very important for them to stay covered, and Legacy's eligibility in the sliding scale process allows them to continue to have coverage. And so I follow mom until their postpartum appointment is completed, and I follow the newborn until the 2-month pediatric appointment is completed. And that 2-month pediatric appointment is extremely also vital, because that's when they get their first immunizations. And especially now with COVID, that is something that, a lot of the moms are concerned about, like immunity. How is my baby going to get this immunity? And so that 2-month pediatric appointment is extremely important, and it allows them to, not only get all the answers to questions that they might have, because if you think about it, they go for their 2 to 3 day hospital discharge appointment, they go to another 2-week follow appointment, and then they don't technically get seen until this 2-month appointment. So it's extremely vital for them to actually have and complete this visit, so that they can not only get all the, all their answers, all their questions answered if they have any questions regarding immunizations, but also any questions that might have come up in between this period. And I, again, re-educate the patient on the importance of pediatric care and its impact on the child's first year of life. And I definitely emphasize the importance of attending all pediatric well child visits, especially because the very first year, there's so many immunizations, and to discuss developmental milestones with the providers. And so I wanted to end with a patient story. And so this is Gabriel. He is the son of one of my PPN patients. In this picture, he is 6 months old, and he loves to crawl. He enjoys eating table food, playing with his light-up toys. He is just adorable. And his mom is, like I said, one of my PPN patients, and one of the reasons why her story will always, I don't think that I will ever forget her, is because his mom had actually had her first child in El Salvador, and that was 17 years ago. So Gabriel is her second son, and her last experience whenever she delivered was in another country. So she had a lot of questions, just, from the get-go, of just the navigation part of, so I keep coming to these appointments until how many weeks? And even, she had lots of questions too for the hospital, like how, to her, it was amazingly different, the delivery from when 17 years ago in another country, and Gabrielle. And so she was extremely just very, very appreciative. And she, even though I don't follow, I stopped following my patients whenever they turn 2 months old. With Gabrielle, this is him at 6 months old, and you'll see him at the next slide when he's now 8 months in his recent Halloween photo session. And so his mom will always tell me about what an impact my program had on her, because if it wasn't for PPN, she would have been lost. Yeah. And the funny thing was that whenever I followed up with her right after delivery, she wasn't even too sure if she wanted to come back to Legacy. She was like, oh, Alejandra, you were so much help. And, she was had heard of other pediatric clinics by some of her friends. And so when I called her, she said, well, I'm still, kind of thinking about where I'm going to take Gabriel. And I said, okay, well, let me know if you change your mind. Not a problem, as long as he has a pediatrician. Of course, I'm going to say Legacy is the best. I'm a little biased, but as long as he has a pediatrician. And she called me a couple of days later and she said, can you please help me schedule his 2-week pediatric appointment? So I met her there, and I have just been, following her ever since. And she has so many great things to say about our program and about Legacy. And she's also extremely, 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 very, very grateful that Legacy was not only able to help her, but also her 17-year-old who was not able to get health coverage through the state. Legacy was also able to assist her in the sliding scale for herself after her delivery, and for her husband, and then also for her 17-year-old. And so whenever I told her about this presentation, she was just delighted. She was like, oh yes, whatever you need, like, let me send you all of his pictures. I want to. And also too, I received an email that I think that his story might even go on some of our other media coverages, and so she's very excited to share her experience and what a positive impact our program has had for her. And this is one of very many, but I wanted to share with you all Gabriel, because he's so cute. And the pumpkin, when I got the pumpkin, I almost fainted. I was like, he's adorable. But I will shift it back. Thank you for giving me the opportunity to just share a little bit about our program. I love the work that we do. I think that it has great positive impact on all of our patients. And I think that, postpartum pediatric navigation is extremely important. And I think that as more time goes by, we learn how to, adjust to things such as COVID. But that's all part of our job, and we love it.
Thank you so much, Alejandra. So we wanted to go ahead and close out the presentation. Jen is giving us spirit fingers. I love it. We wanted to close out the presentation, which is highlighting what some of our challenges were, as well as what we have learned through this process. Initially, when we first dreamed up this wonderful process and workflow, home visits were included. However, we had to remove them due to, of course, liability and licensure concerns for our organization. In addition, we identified some duplication in workflows with the hospital-based navigators. So we have hospital-based navigators that, of course, work and collaborate with Legacy. However, we wanted to, we identified a few challenges where Alejandra, when she reached out to the patient to confirm that their postpartum appointment and their pediatric appointment was scheduled. However, the hospital had scheduled the patient for their system. So we did identify that there's been a little bit of competition there, but we have worked through that. There's been a slight difficulty in creating a methodology that accurately measures the impact of our visit return rates. And so we are working with our operations leadership and the operations service line to make sure we revisit how we are capturing and reporting our data so that we're able to provide more information in regards to these return rates in the future. And then, of course, as Alejandra has shared, as well as Jen, COVID response has definitely impacted our staff capacity, our patient show rates, and delivery room access. So pre-COVID, a patient could send a call, have a call or send a text to Alejandra, hey, I delivered, I'm at the hospital. Alejandra's on the way with the baby gift and ready to see the patient with their laptop to schedule appointments. However, due to COVID, as we know, many patients were barely able to have family members in the room after they delivered. So with those considerations, that has been, we've had to revise the way we work a little bit to make sure that these patients are still engaged. On the other side, what have we learned? We've learned that it is important to have an Alejandra. So our high-risk OB patients definitely need a direct point of contact to navigate this complex system of care. Even within our organization, we have a number that is on some of our materials that a patient can call. However, it connects them back to the contact center. And then sometimes if a patient is in the hospital and they've just delivered, that can be very challenging for them. However, patients that are enrolled in our PPN program, they are able to reach out directly to Alejandra. Alejandra is able to make sure, they have their appointment scheduled, again, assist with eligibility, as Alejandra had mentioned, provide access to care for other members of the family, and really be that warm handoff and that point of contact for our patients. We've also learned that buy-in from every single touch point is essential. So this includes our providers, as well as our partners and collaborators at the local hospitals where our patients deliver. So we were very fortunate to have buy-in from our pediatric medical director and obstetrics medical director when we were dreaming up this project and working through the development of the workflow. And it has definitely been a really great asset for us in the development of this process. Also, we've learned that co-visits allow for efficient use of patient time and education. So having Alejandra go to that 30-week appointment and reach out to the providers even leading up to the appointment to let them know, hey, I would like to participate and get their approval, and having that opportunity to complete a co-visit has also been very beneficial. For those that do work in clinical settings, sometimes you know that once a patient leaves the clinic, it's sometimes hard to capture them. So Alejandra has, been awesome in having the ability to go and meet and visit with these patients at the clinic at their point of care. And then last, we have learned that a detailed procedure for enrollment to closeout is definitely important. This includes what scripts we use, what enrollment documentation, what consent forms are on file, and making sure all of those things are a part of the patient's medical record. Is that whole process, making sure we have clearly defined workflows. It has been definitely important and a benefit to us. So with that, I think we are done, but we are open for questions. So all of our panelists, we'll unmute ourselves, and if there are any questions, please add it to the chat and we'll respond.
So to get us started, I have some questions that I'd like to pose to Alejandra and Ashley to share their thoughts for our viewers and listeners. So to start off, one of the concerns in Houston, Harris County, and statewide have been our disproportionately high rates of maternal mortality, and that's been a concern for us. There's been quite a lot of local community mobilization around policy and practice solutions to prevent maternal mortality. I'm curious what your thoughts are in regards to how a program like PPN can help prevent maternal mortality and morbidity. How can programs like this contribute to that overarching public health cause?
Sure, I think I'll jump in on this one, Alejandra.
Feel free.
So I think that having that point of contact where a patient knows that they can contact Alejandra. Again, the patients that are enrolled in this project are high-risk patients. And so we know that before they deliver, and that is what helps qualify them to engage in this process with us. So I think having that warm point of contact is definitely important and impactful for these patients, where they don't have to call the contact center. If they need an appointment scheduled, they can contact Alejandra directly. Also, ensuring that these patients go and complete their postpartum visit. We know that we need high postpartum visitation rates, and ensuring that our patients that, many times, especially if a patient has had other deliveries before, it's like, oh, I'll be fine. Everything was great. I'm now focused on the baby. All is well. However, we want to, again, make sure that these patients are being linked back to that postpartum visit. So I think that having this program has been definitely essential and quite important for helping us impact and reduce those risk factors for maternal mortality in our patient population.
Great. I had another question. Perhaps Alejandra could answer this for us. We know that many of our listeners and viewers may be current practicing health educators or health educators in training. This is their intended career path. And even if health educators don't work with parenting and pregnant patients, they certainly come in contact with people who are considering their reproductive life choices. So I'm curious what advice you would give, Alejandra, to a health educator about what are some of those key messages one should impart about planning to be a parent, planning to become pregnant, regardless of what the health educator's focus is? If you had to pick, I don't know, one or two.
I think that, as I mentioned before, I think that education is a key component of, I think, the decisions that we make. And so I think that if you as a health educator, we want to be readily available and be answered be available to answer questions that, our patients might have. And so I think that one important thing to do is try and, it's kind of like the saying, the more you know, the better you feel, and I think that, at least in myself, I did have some of that, you know, previous employment history, but I think that for, maybe the people on this phone call that are, are aspiring to be health educators, I think that keeping an open mind and trying to learn as much as you can about different, not just about parenting and but as a health educator, you're gonna need like a lot of different like roles in life. And so I think that if you just try and like learn about different aspects, I think that that's gonna help you and that's gonna make you feel more comfortable. And if you don't always have someone to just, ask, like I know I ask Ashley a million questions, when, in the process of starting this procedure and how our workflows, how that, all of that, I had so many questions. So always having like a leader that you are comfortable in asking questions and receiving that feedback, because I know that there were a lot of times where, constructive feedback is important and essential. And I think that as if you try and learn about, parenting and even leading up to that, right? Even if you don't ever become a parent, because that's, as health educators, like I said, we need to be open and know, and even working with legacy, like I've learned a lot, of different aspects in public health that I didn't know of before. And so I guess just keeping an open mind and then just trying to, keep the focus of just trying to like always learn more. I think that knowledge is key. And so I think that as long as you have a little bit of background and know a little bit about it, I think that that's going to help a lot.
Something you just said, I think, is so key, which is, we tend to think about reproductive life planning as becoming pregnant and becoming a parent,
Right.
but it's also making a choice to not become pregnant and not
Right.
become a parent.
Right.
And that's why, certainly at Legacy, part of our practice is to apply what we call the one key question, which is, do you want to become pregnant or be a parent in the next 12 months? And depending on that answer, we have services in either direction. And if the answer is yes, then eventually they may end up working with you, Alejandra, as their postpartum pediatric navigator. But if their answer is no, it's important to know that there are services for prevention of pregnancy as well as services to support a healthy pregnancy. We do have one more question that came from one of our participants, and the question is, do you do any breastfeeding screening or offer resources for mom who are interested in breastfeeding?
Yes, definitely. So we do have a lactation consultant that is within Legacy. And she is awesome about if any one of my patients have any questions or concerns, even pre-COVID and now after COVID. So after COVID, she's available through Zoom. She's always available through phone, and her name is Yanette. She's great about, she's located at a different clinic where my program is, but she's always available to answer questions. And so the lactation consultant within Legacy, and also too, if they need as far as pups, WIC is also a great resource. And like I said, I worked with them for 3 years. And so I know where to send them to. And then also myself, I also have some experience too. So I'm able to answer any questions that they might have. And if I'm not able to answer them, that's, I also give a warm handoff to Yanette, which is our lactation consultant, and also for WIC. And also too, I do have a resource page that I can give to these patients if they have any questions, that have all of the great websites such as La Leche League, breastmilkcounts.org. And so, and there's also, I also always remind them too that, if they have whenever they have health coverage, there's always a 24/7 nurse hotline that you can always call, which a lot of people don't know about that. And so I kind of just remind them, hey, if it's 3 a.m. and you have a question and you're not going to be able to sleep, or you want that question and that answered now, you can always call that as well, the 24-hour hotline. And then also too, as far as screening, we do incorporate also to part of the parenting action plan, and even during the pediatric visits that I have is, do you have any concerns about, breastfeeding, or, or if you don't want to breastfeed? Sometimes it's the complete opposite. I want to get, I don't want to breastfeed, and how do I make my, how do I get past this, and so that's another question, great question that Yannette has also been able to answer, and how to alleviate, some pain that you might experience, or how, and that's another thing that I was trying to say too, is keep an open mind, just because some of these moms might not be able to breastfeed. Some of them might not want to breastfeed. Sometimes it's, like a cultural preference. And so, like I said, keeping an open mind and just having resources available to give that to them is always, it's worked great so far, and having Yannette on team also too. And also, at least here in Houston, there's the Lactation Foundation, which is awesome, part of UT Health System, and they are also free services. A lot of people do not know about them. Those are they're like part of the UT Health System, but they are accessible to anyone. Anyone can use them. You don't have to be a UT Health member, and those lactation consultants are also great. And I actually also know them because they're part of, I used to work for UT Health WIC, so they are also just a phone call away. If any of my patients are having any issues, call them and we'll get them in. Or even now, like I said, pre-COVID, these Zoom meetings are extremely helpful, because now they don't have to actually leave their house and have any of these sessions. And I know, as well as we also were incorporating breastfeeding classes too within Legacy. And so we have tons of resources available if they need any assistance.
So as a wrap up, I want to ask both of you, what are you most hopeful for with our postpartum pediatric navigation program? If you had a PPN vision board going into 2021, what would be on your vision board for this program? Give a minute. 30 seconds. This was an unplanned question.
I have one.
All right, Ashley.
Expansion.
What's on your vision board for this program?
Expansion. So expansion to all of our sites where we have the OB service line and the pediatric
You
service
stole
line.
mine. I should have said it first.
Gotcha. Yeah, but having that opportunity to expand, Alejandra has already facilitated the expansion into our one of our centrally located clinics, but expansion into our other clinics is definitely on my wish list for this program.
Did she steal it, or Alejandra, do you have something else?
No, she stole it. I was going to say that there are more of me, all throughout Legacy. And like I said, it's because I've been doing it already for so long. I know the importance of it. And I think that, I tell my family all the time, I wish I had a navigator.
Mm-hmm.
I wish all moms had had a navigator, because like I said, it's extremely important for these patients to have.
Well, we will have to get back together in another year from now, when our postpartum pediatric navigation program is 2 years old, and see how far we've come. So on behalf of Legacy Community Health, Legacy Public Health, and our postpartum pediatric navigation program, we thank everyone for tuning into this webinar today. And with that, I'd like to turn things back over to Texas Sophie. Haley, do you have any closing remarks for us?
No, I do not. So thank you so much, you guys, for presenting today and being part of our webinar series. You should be receiving the evaluation link via email this week. So we are in the process of filling out or creating, those surveys for the 2 webinars that we had this week. So just keep an eye out in your email. for an email from tsophie@gmail.com to fill out this evaluation link so you can get your chest or in that great day and be safe. Thank you so much again for today's presentation.
Bye, everyone.